Welcome. Thank you for being here today. We are going to talk about something that affects millions of older adults, that is arthritis. If you feel stiff in the morning, or if your knees hurt when you stand up, this video is for you. We will talk about what arthritis is, the different types, the symptoms, and how to manage it. I will use simple words and compare things to everyday life, so it is easy to follow. Let us start. What is arthritis? Arthritis means swelling or inflammation in your joints. Joints are where two bones meet, like your knees, hips, fingers, or shoulders. When you have arthritis, those places can feel painful, stiff, or swollen. You might find it hard to move or do normal things, like getting up from a chair or opening a jar. Arthritis is not just one disease, it is a group of conditions that affect the joints. Some types are more common than others, especially in older adults. Let us look at the main types. The most common type of arthritis is osteoarthritis. You may have heard it called wear and tear arthritis. That is because it often happens after years of using your joints. The cartilage, which is the cushion between your bones, wears down over time. Without enough cushion, bones rub against each other. This causes pain, swelling, and stiffness. It usually affects the knees, hips, hands, and spine. Many seniors have osteoarthritis. If you feel pain in your knees after walking, or if your hands feel stiff in the morning, this could be why. We will talk more about how to manage this later. Another type is rheumatoid arthritis. This one is different. It is not caused by wear and tear. It is caused by the immune system attacking the joints. That means your body is fighting itself by mistake. This can cause pain, swelling, and even damage to the joints. Rheumatoid arthritis often affects both sides of the body, like both hands or both knees. It can also cause tiredness or fever. It is less common than osteoarthritis, but it can be more serious if not treated. Another type of arthritis is gout. This one comes from too much uric acid in the blood. Uric acid forms crystals in the joints. That can cause sudden and very painful attacks. It often starts in the big toe, but it can happen in other joints too. Gout pain is usually very sharp. It might wake you up at night. It can feel like your toe is on fire. Gout can be triggered by certain foods and drinks. For example, red meat, seafood, alcohol, and sugary drinks can raise uric acid levels. Later, we will talk about how to avoid gout attacks with simple changes in your diet. There are also other types of arthritis, like psoriatic arthritis and lupus-related arthritis. These are not as common in seniors, but are still important to know. They are usually connected to other health conditions. If you have psoriasis or lupus and joint pain, talk to your doctor. Now that we know the types of arthritis, let us talk about the symptoms. The most common symptom is joint pain. The pain might feel like a dull ache. Sometimes it can be sharp. It may be worse in the morning or after sitting for a long time. Moving around may help, but too much activity can make it worse. Pain can come and go, or it can be steady. Another symptom is stiffness. Many people feel stiff when they wake up. It might take 15 to 30 minutes to feel loose again. This is very common in osteoarthritis. In rheumatoid arthritis, the stiffness can last longer, sometimes more than an hour. Swelling is also common. When the joint is inflamed, it may look bigger or feel warm. You may notice that it is hard to bend or straighten your fingers or knees. Sometimes the joint makes a cracking or popping sound. That is called crepitus. It happens when cartilage wears down and bones rub together. It can sound scary, but it does not always mean something bad. If there is pain with the sound, then it needs attention. Another sign is loss of movement. You may find it harder to walk, lift, or grip things. You may stop doing certain hobbies or chores because they hurt too much. That can affect your daily life. In some types of arthritis, like rheumatoid arthritis, you may also feel tired or have a low fever. This is because the immune system is active and causing inflammation. Fatigue from arthritis is not the same as being sleepy. It is more like your body feels heavy and you have no energy. If you feel like this often, speak to a doctor. Now let us talk about the causes and risk factors of arthritis. The first and biggest risk factor is age. As we get older, the joints naturally wear down. That makes it easier for arthritis to develop. It is very common in people over 60. The second factor is family history. If your parents or brothers and sisters have arthritis, you may be more likely to have it too. Genes play a role in some types, like rheumatoid arthritis and gout. Weight is also a big factor. Extra weight puts more pressure on the joints, especially the knees, hips, and back. For example, every extra 1 kilogram of weight adds about 4 kilograms of pressure to your knees. That means just 5 extra kilograms adds 20 kilograms of pressure when you walk. Losing weight can help reduce pain and slow down joint damage. Injuries can also lead to arthritis. If you hurt a joint when you were younger, maybe from sports or a fall, it might cause problems later in life. Injuries can damage the cartilage and make the joint weaker over time. Repetitive movements from work or hobbies can also wear down the joints. If you used your hands a lot in your job, like typing or lifting, you may have arthritis in your fingers or wrists. If you did a lot of walking or climbing, your knees or hips may be affected. Some diseases, like diabetes or autoimmune conditions, can also increase the risk. People with high blood sugar or poor circulation are more likely to have joint problems. Now let us talk about how arthritis is diagnosed. Doctors usually start by asking questions. They will want to know where you feel pain, when it started, and what makes it better or worse. They may also check your family history and daily habits. Then, they will do a physical exam. They will press on your joints, check how well you move, and look for swelling. This helps them understand which joints are affected. Doctors may also order X-rays or MRI scans. X-rays can show if the space between bones is getting smaller. That means cartilage is wearing down. MRI scans can show more details, like inflammation in soft tissues. They might also do blood tests. These can help check for signs of inflammation. They can also help find out if you have rheumatoid arthritis or gout. For gout, they might test the fluid in your joint to look for uric acid crystals. Getting the right diagnosis is important. Different types of arthritis need different treatments. Once the doctor knows what kind you have, you can start managing it the right way. Let us now talk about treatment and management options. There is no complete cure for arthritis, but there are many ways to reduce pain and live a better life. Treatment depends on the type of arthritis you have, how serious it is, and your health condition. The first option is medication. There are many types of medicine for arthritis. Some help with pain, some reduce swelling, some protect your joints from further damage. For pain relief, doctors often suggest acetaminophen. You might know it as Tylenol. It helps reduce pain but does not reduce swelling. It is often used in early stages or for people with mild arthritis. Another type is non-steroidal anti-inflammatory drugs called NSAIDs. These include ibuprofen and naproxen. They help with both pain and swelling, but they can cause stomach problems if used too often, especially in older people. So always take them with food and talk to your doctor before using them regularly. There are also topical creams that go directly on the skin. These can help numb the pain or reduce swelling in the area. For example, creams with capsaicin made from chili peppers can reduce pain signals in the nerves. Some creams feel warm, others feel cool. They work best for small joints like fingers or knees. In more serious cases, doctors may prescribe stronger medications like corticosteroids. These reduce inflammation fast. They can be taken as pills or as a shot into the joint, but they should not be used too often because they can cause side effects like weak bones or high blood sugar. People with rheumatoid arthritis may need DMARDs. That means disease-modifying anti-rheumatic drugs. These help slow down the immune system's attack on the joints. They do not work right away. They may take weeks or months to show results, but they help protect the joints from long-term damage. Another kind of medicine is called biologics. These are used when other medicines do not work. They are more advanced and target specific parts of the immune system. Biologics are given by injection or IV. They can be very helpful, but are usually more expensive. Let us now talk about exercise and movement. Many people with arthritis are afraid to move because they think it will hurt more. But gentle movement is actually one of the best things you can do. Exercise helps keep the joints flexible. It strengthens the muscles around the joints. It helps you stay mobile and independent. Start with low-impact exercises. Walking, swimming, and cycling are good choices. They do not put too much pressure on the joints. Even 20 to 30 minutes a day can make a big difference. If that feels like too much, start with 5 to 10 minutes and build up slowly. Stretching is also important. Stretch in the morning to loosen your joints. You can also try gentle yoga or Tai Chi. These help with balance, flexibility, and stress. Always listen to your body. If a movement causes sharp pain, stop and rest. If it feels like normal soreness, that is okay. With time, you will feel stronger and more confident. Next, let us talk about diet and supplements. There is no special arthritis diet, but eating healthy can help manage symptoms. Focus on anti-inflammatory foods. These include fruits, vegetables, whole grains, nuts, and fish. They help lower swelling in the body. Omega-3 fatty acids, found in fish like salmon or sardines, can help reduce joint pain. You can also get omega-3 from walnuts or flax seeds. If you do not eat fish, a fish oil supplement may help. Look for one with about 1,000 milligrams of EPA and DHA per day. That is equal to eating 2 small servings of fatty fish per week. Vitamin D and calcium are also important, especially for bone health. Low vitamin D can make arthritis symptoms worse. Most people over 60 need about 800 IU of vitamin D per day. That is equal to about 3 slices of grilled tuna or 4 cups of fortified milk. Calcium helps keep bones strong. Aim for 1,000 to 1,200 milligrams of calcium per day. That is about 3 servings of dairy, like milk, yogurt, or cheese. Some people try glucosamine and chondroitin. These are natural substances found in joints. They are sold as supplements and may help some people with osteoarthritis. They are not magic pills, but they may reduce pain after a few months of use. Talk to your doctor before taking them, especially if you are on blood thinners. Drink plenty of water. Dehydration can make joint pain worse. Try to drink 6 to 8 glasses a day unless your doctor says otherwise. Now let us talk about devices that can help. These are tools that make it easier to move and reduce pressure on your joints. For example, a cane or walking stick can help take weight off your knees or hips. A walker gives more support and helps with balance. There is no shame in using these. They help you stay safe and independent. There are also special tools for the hands. You can use a jar opener, a larger grip on a pen, or an easy pull zipper. These small changes can make daily tasks easier. You can also wear braces or splints. They support the joints and reduce pain. They can be used for the knees, wrists, or fingers. Shoe inserts can also help. They reduce pressure and improve balance. Ask your doctor or physical therapist for advice. In some cases, surgery may be an option. This is usually for people with very serious joint damage. Common surgeries include joint replacement, like getting a new knee or hip. These surgeries can reduce pain and improve movement. Recovery takes time, but many people go back to normal activities after healing. Now let us talk about daily life tips for managing arthritis. Start by keeping a routine. Move your body every day. Eat healthy meals. Take medicine as prescribed. Write down your pain levels or symptoms in a notebook. That helps you and your doctor see what is working. Use heat and cold to manage pain. A warm shower in the morning can loosen stiff joints. A heating pad can relax tight muscles. Cold packs help reduce swelling after activity. Try each method and see what helps you. Plan your activities. If you know that cooking or cleaning makes your joints hurt, break tasks into smaller steps. Rest between activities. Use tools that make the job easier. Do not try to do everything at once. Protect your joints when lifting or moving. Use 2 hands instead of 1. Hold items close to your body. Push with your legs, not your back. Try to keep a healthy weight. Even small weight loss can help reduce joint pain. Losing just 5 kilograms can lower knee pain by 30%. That makes it easier to walk, stand, and move. Stop smoking if you smoke. Smoking increases inflammation and makes arthritis worse. It also weakens your bones and reduces blood flow. Make your home arthritis-friendly. Use chairs with arms. Add railings to stairs. Put things you use often within easy reach. Avoid low chairs or soft couches that are hard to get out of. Let us now talk about the emotional side of arthritis. Living with pain every day can affect your mood. It is normal to feel sad, frustrated, or tired. Some people feel isolated or useless. But remember, you are not alone. Many people live well with arthritis. Stay connected to others. Talk to family and friends. Join a support group. Sharing your story can help you feel better. You can also learn tips from others. Do not be afraid to ask for help. If you need help opening jars, going to appointments, or shopping, ask. People are usually glad to help. but they may not know you need it. Mental health is just as important as physical health. If you feel sad most days or lose interest in things you enjoy, talk to your doctor. You may need support, counseling, or medicine to feel better. Let us now talk about when to see a doctor. Do not wait until the pain is very bad. See a doctor if you have joint pain that lasts more than a few days. You feel stiff every morning. You notice swelling or redness in your joints. You cannot move a joint like you used to. Your fingers or toes look crooked or misshapen. You feel tired all the time without reason. Your joints are making your life harder. Early treatment can prevent more damage. It also gives you more options for care. Now let us finish by talking about some final tips and encouragement. Arthritis can be a long journey, but there is hope. Many people live full, active lives with arthritis. First, remember that you are in control of many things. You cannot change your age, you cannot change your family history, but you can change your daily habits, you can eat better, you can move more. You can ask for help when you need it. These small actions make a big difference over time. Make a plan with your doctor. Set small, realistic goals. For example, walking 10 minutes each morning, or eating 1 extra serving of vegetables per day, or doing stretches before bed. Every small step adds up. Keep learning about arthritis. The more you understand it, the better you can manage it. Ask your doctor questions. Read simple articles or watch trusted videos. Knowledge gives you power. Stay active in a way that feels right for your body. Some days will feel better than others. That is normal. On hard days, take it easy. On better days, do a little more. Listen to your body, but do not let arthritis stop you. Try to keep doing the things you love. If you enjoy gardening, find ways to make it easier. Use a stool. Work in short sessions. If you enjoy walking, go at your own pace. If you enjoy spending time with others, do not stay isolated. Talk openly with your loved ones. Tell them how you feel. Let them know what you can and cannot do. They may not understand arthritis unless you explain it. Find joy in small things. A warm bath, a good meal, a visit from a friend. These moments help lift your mood and give strength. Try to keep a positive mindset. This does not mean pretending everything is fine. It means choosing to focus on what you can do, not just what you cannot. You are stronger than you think. Be patient with yourself. Some treatments take time. Some exercises feel hard at first, but over time your efforts will help. Many people feel better within weeks or months of starting a good routine. If you ever feel overwhelmed, remember this. You are not alone. Millions of people are going through the same thing. Help is available, support is available. You do not have to face arthritis by yourself. Let us quickly review what we have talked about today. Arthritis is a condition that affects the joints. It causes pain, swelling, and stiffness. There are different types. The most common are osteoarthritis, rheumatoid arthritis, and gout. Symptoms can vary, but the most common are joint pain, morning stiffness, swelling, and fatigue. Risk factors include aging, genetics, being overweight, injuries, and lifestyle. Arthritis is diagnosed through exams, blood tests, and scans. The right diagnosis helps you get the right treatment. There are many ways to manage arthritis. Medicines can reduce pain and swelling. Exercise keeps your joints flexible and your muscles strong. A healthy diet supports your body and reduces inflammation. Supplements like omega-3, vitamin D, and calcium may help. Assistive devices can make daily life easier. Surgery is an option for severe cases. It is also important to take care of your emotional health. Pain can affect your mood and energy. Support from friends, family, or groups can make a big difference. Talk to your doctor if you feel sad or tired often. Make small changes in your home to help you move safely. Take breaks, use tools, protect your joints. All of these actions make life easier. See your doctor if your symptoms get worse or if you feel something is wrong. Early care gives you the best chance to feel better. Before we end, I want to say this again. You are not helpless. Arthritis is challenging, but it does not have to take away your joy. You still have a life to live. With the right steps, you can reduce pain and stay active. Keep moving forward. Take one step at a time. You are doing your best, and that matters. Thank you for watching. I hope this video helped you understand arthritis and how to manage it. Take care of yourself. And remember, Every small action is a victory.